Welcome. Welcome to the Population Health webinar. We are concerned about COVID vaccine. So as a result, the Population Health team, we decided to have a dialogue. My name is Dr. Carol Jenkins Neal. I'm the chair of the Population Health Committee. Welcome. So we want to start by introducing our esteemed panel today. And I'm going to start off with we have Dr. Pier Broadnax, we have Ms. Dell Oliver, and we have Ms. Angela. Can you say your last name, Angela?
Adjetey-Appiah.
Thank you. And I'm getting ready to read their bios. I'm going to share my screen. And I'm going to start off with reading the bios of our esteemed panelists. And after the dialogue, we will watch a little video, and then we're going to get started with our dialogue. Okay? So again, our very first panelist will be Ms. Angela. Angela, as you can see, she has been a nurse for at least 23 years. Her years in nursing has been in the healthcare administration and leadership, as well as nursing. She's also a doctoral student, and I have to back up. She is currently the Associate Vice President of Oncology Services, and she's also an adjunct faculty member at Pace University. She's currently a doctoral student. Angela is pursuing a PhD and a DNP nursing program at the same time. As you can see, she's had numerous past leadership experiences all over in various settings. She has professional leadership, clinical operations background, and she has a past experience as a clinical nurse specialist, a nurse coordinator, a nurse case manager. She can run an entire hospital by herself from looking at all of this experience. Angela is a fellow of numerous nursing organizations. I mean, look at this, the American Organization of Nurse Executives. I mean, I can go on and on with all of the many different nursing organizations. She's a member of the National Black Nurses Organization, as well as with the local chapter of the Greater New York chapter. And she's very involved with Oncology Nursing Society as well. Angela has also co-authored a book, Chapter 21 on the 21st Century Nursing Leadership, Mentoring, and Coaching, okay? Angela, as you can see, just look at her numerous experiences and multiple presentations. Her research and evidence-based practice interests are in cancer prevention science, control health promotion, early detection of cancer. I can go on and on. She has served on numerous advisory boards, not only locally, nationally, but globally as well. Angela feels that she is 100% dedicated to her husband and her 2 children. Thank you, Angela. Our second esteemed panelist is Ms. Pier Broadnax. She is the president of the Black Nurses Association of Greater Washington, D.C. She has over 40 years of experience in professional nursing as a direct provider, educator, mentor, administrator. She has always advocated for the vulnerable population. And I could tell she has worked a lot in the community, not only community, different mentoring different populations, but also mentoring faculty member in the academic setting as well. Dr. Broadnax has conducted research on various levels, locally as well as internationally, on breast cancer. Dr. Broadnax believes in today's healthcare environment, developing partnerships with peers. And I believe in that too. Collaboration is the key in this day and age. She believed in working in the schools of nursing, communities, and also at the legislative levels, because in order to work at the legislative levels, that is how you're going to have a change and impact the communities and the underserved populations. Dr. Broadnax has assumed several leadership roles in health policy. She advocates for different councils and professional organizations and national initiatives. She's a nationally well-known speaker on various topics. She specializes in nursing education and health disparities. She was recognized in 2013 for the Nurse of the Year Award by her local Washington chapter. She's the current chapter president for 3 years. She attained her undergraduate degree from Winston-Salem State University, her graduate degree in adult nursing and administration from Hampton University, and she earned a PhD in nursing and health policy from George Mason University. Our third speaker today would be Ms. Daphne Oliver. She likes to go by Dell. Ms. Dell is a chief nurse officer at Hackensack Meridian Health Mountainside Medical Center. As you can see, this is a huge hospital, 365-bed community hospital. Before joining this facility, she worked as an associate vice president of nursing leadership. She worked in executive development, and she's held various leadership roles as well. She earned her bachelor's degree in nursing from the University of Alabama. She later earned her master's degree of business administration of healthcare management and her master's of science in nursing degrees from the University of Phoenix. And she's currently completing her doctoral in business administration this year. She is also a fellow with the American College of Health Executive, and she maintains a nursing license in New Jersey, Tennessee, and the state of Florida. She is also a certified coach, maintains certifications in multiple assessment systems. And Dell, in spite of all of this, she finds time to volunteer. Wow. She also volunteers on several community and collegiate organizations, the Urban Leagues in Tennessee, as well as New Jersey, the Moves and Grooves Incorporation, for underserved minority youths and school programs and nurse leadership councils. I mean, she's a very busy person, but personally for Dell, she enjoyed just spending time with her family, watching comedy shows, and traveling whenever possible. I just want to say thank you to Ms. Dell, to Ms. Pier Broadnax, and to Ms. Angela for joining us today and serving on our panel and being able to start the dialogue of what's very important with COVID-19. At this point, I would like for us to watch a short 2-minute video on the concerns about COVID in the healthcare community. Tracy?
The COVID vaccine. You've heard about its rocky rollout, and now new data shows that minorities at much lower rates. Media mogul Tyler Perry stepping in, trying to boost that number with the health of Grady Health System. 11 Alive's Natisha Lance joining us now live with how he's hoping to make that happen, Natisha.
Well, Jennifer, as you mentioned, we know that community of colors and COVID-19 have faced a lot of challenges. Black and Latino Americans are dying at a rate 3 times higher than white people and are hospitalized 4 times more. So Tyler Perry and Grady Health System are coming up with a new approach, trying to raise some hope within the community and also trust. A chaotic rollout of the vaccine and continued skepticism of it is keeping minority deaths and hospitalizations soaring above white counterparts. And now, new data analysis by the Kaiser Family Foundation found alarming racial and ethnic disparities in COVID-19 vaccinations in 16 states. That data unavailable in Georgia. The state does not track who gets the vaccine according to race.
This is not just a health care issue. It goes into housing, it goes into education. So if there are partnerships that can be formed between healthcare organizations and other community-based organizations to get to those individuals, that is partially how we will solve healthcare disparities.
Grady Healthcare System teamed up with Tyler Perry to help spread the word on the vaccine.
So the idea of Grady was that we will approach Tyler Perry, who's an opinion leader, because we know that key opinion leaders are very important.
The plan was to capture the moment the media mogul received the vaccine.
He said, this is not just about a photo. This is about educating the community.
1 in 3 African Americans are hesitant to get the vaccine, according to Kaiser. Even Perry had to be educated on it before agreeing to take it. He put his experience and the information learned together in a special set to air Thursday on BET. But Dr. Carlos Del Rio says making sure communities of color have access to the vaccine is just as important.
Number one, we need to get out to the community. We need to set up vaccination sites, for example, in African-American churches, in places where people in the community hang out. We need to go to the community, not want the community to get to us.
And Dr. Del Rio believes that building this trust and getting this information could be transformative. Not only did it convince Tyler Perry to get the vaccine, but also somebody who is on his staff, Jennifer.
All right, we'll have to see how that goes. Natisha, thank you so much.
So thank you very much. As you can see, we have a lot of concerns with the vaccine, and that is the reason for this webinar today. So we're going to start the dialogue, and I would like to go to you first, Angela. The very first question, could you please tell us about the history of vaccination, Angela?
Yes, so certainly. So as we all know, the history of vaccination dates back way in the 1600s. Where early Chinese inflation started, and then it triggers to the smallpox epidemic, the whooping cough, and it all the way down to measles and so on and so forth. But I think one thing that the plagues and the pandemics in the past have taught us is that how minorities or people of color have being treated in the process. So that history tends to influence, even till today, how we view vaccines that come up. We've also seen clinical trials like the Tuskegee studies that have also made us question a lot of things that is put out, especially for our communities. These histories, obviously, that we cannot overturn. However, does have taught us a lot about where we're going, where we're heading, should be the approach we use. I mean, currently we do have people of color in different organizations that the more we are out there in the community teaching, the better it will be for our community to know exactly how we're representing them. And also, it's not just about giving data and providing that please go get it information, but also answering questions and setting that tone of comfort for others to receive the vaccine. But we cannot discredit history, and we cannot ignore it. The best way we can do it is have that teach us the next steps in what we do. So example of that would be for us as leaders or nurses to be able to use that forum as advocates for not just our patients, but our communities as well. We know firsthand, majority of the time, nurses, whether you're in the hospital, in the schools, or in the community, we are receiving a lot of information about the vaccine, and knowing the facts about them will help us bridge that gap. And make history guide us in essence of changing that trajectory. Because of that, a lot of minorities and people of color, as you saw in the video, Hispanics and Blacks really are not, moving forward with, oh, I'm going to get this vaccine, because you're hesitant about how it was expedited or what the questions they have that needs to be answered. I agree that we need to go to the community. Because majority of the us or the population that are not getting the vaccine are in the communities that are hard to reach. So if it's mobile vans or dedicating our outreach nurses to be more in tune with the history and how to change that course, will be beneficial to making an impact in getting people vaccinated.
Thank you. Thank you. Anybody have any questions for her based on on her laying out the history of getting vaccines? Anybody have any concerns about that? None? Okay. One of my questions, I love the idea of getting the mobile vans to the to the community. Let's say you're a nurse that just works in a regular hospital and you see it, you have the same concern. How would they go about setting that up, or how would they even get started? Who do they get in touch with to get something like that? Because I'm sure there's a cost to that to get the mobile van. And then who do you get in touch with to get the vaccine? I wouldn't even know where to start.
That's a good question. So majority of hospitals or health systems do have what we call outreach programs. So whether it's a nurse who leads it or someone with a public health background, they're basically situated to work with the community to meet the needs. So that is where I would start, is try to find in your organization or in your community what that person is. In most hospitals, do put out on your website, or just call a hospital directly and ask for the outreach manager or outreach personnel. That is a good place to start to advocate for the community. And if you basically have a conversation and say, this is what we need, and we would like to see if your hospital or your health system will work with us. And especially if you're a nurse who works in that organization, it goes a long way. And those are the kind of outreach we have to start doing to advocate for our communities. It's seek out those resources. Places like the YMCA or CVS do have these programs as well too, because majority of the time they do have that budgeted into their work processes. So we just don't know about them. And as nurses, it's about educating ourselves to try to help our communities.
Thank you. That's a good answer, because I was sincere. I really didn't know. Go ahead.
Before we move on, I would also like to add that works well in urban environments, but in rural environments, they may have to engage in a different strategy, because the hospitals may not have the funding that is needed for a mobile unit. So they may have to collaborate with hospitals that are located in urban areas that may have the resources so that people can have access to the vaccine.
Thank you. Okay, so let me move on to the very next question. And this question is for you, Dr. Broadnax. Are you ready?
Yes.
And the question is, could you tell us about the overall healthcare experience for minorities in a hospital? Because right now, as the video said, minorities, they are kind of skeptical about taking this vaccine. Why do they have that distrust? What is their overall healthcare experience like for them to have a distrust where they don't even want to take a vaccine?
The vaccine has been available in the United States since around mid-November, and people were extremely fearful of the vaccine. And it began, and every time you would hear people talk about being fearful, they would throw out the term Tuskegee with not really understanding or appreciate the impact that the Tuskegee experiment has had through the generations. It wasn't just a word, it wasn't just a event that happened. It has continuous meanings, which has impacted throughout, since the 30s and 40s, all the way to now. And so, but it was not just a Tuskegee experiment where men were not provided treatment and were offered what they perceived as free health care in order for them to participate in the experiment. But also more recently, we've heard of Henrietta Lacks, the person who was the patient who was admitted to one of the hospitals in Baltimore.
Johns Hopkins,
where the physicians actually took her cervical cells and to this day, they're still using it to create pharmaceuticals without her permission, without informing her that what was going on. And when we hear about these things that happen, we know that it's not limited to majority physicians, that African-American physicians had a part in, physicians as well as nurses had a part in these activities also. And then we move on to today's world where we see disparities. We call them disparities, but we know about health, infant mortality, maternal mortality, higher rates of amputations from diabetes in minority population. It's over and over and over, as well as how especially our elders have been mistreated when they seek health care. And just recently, Dr. Susan Moore, the physician who sought health for what she believed and what ended up being the coronavirus, and she was turned away numerous times, was not tested, and was not given the treatment that she specifically requested. So there's a reason for the fear. It's not born out of a lack of education. It's actually born out of our experiences and experiences of our families and friends and others that we actually observe in the workplace. So it did not occur out of whole cloth. And so this fear is real, and I always believe that you have to acknowledge that the fear is real. Don't dismiss it as if people don't really have a reason to be fearful of the medical community. Address it, acknowledge it, build from their fears, try to alleviate the fears, continue to educate about the importance of vaccines, and see if we can increase the rate of compliance.
So basically you're saying as healthcare professionals, we should, even though they have the fear, it is best for us to go to these people, educate them to dispel the myths and misconceptions about the vaccine. That's basically what you're saying. And go ahead.
Because they don't trust things that are new.
Mm-hmm.
We watch CNN, we watch the local news,
Mm-hmm.
we read the papers, and we fear that maybe there has been a shortcut.
Oh.
But since November, we see that the virus has been effective.
Mm-hmm.
So more people are listening to, they are open to the education. They are more open to receiving the vaccine. But then what occurs, there are other challenges and barriers to actually being vaccinated.
Well, I just happen to be the member of a local population health community organization in Jacksonville, and we do community conversations. So we go all across the community educating about the vaccine. And the takeaway would be, one lady says, I'm not taking the vaccine until Dr. Fauci tells me to take the vaccine. Then all of a sudden we saw Dr. Fauci on TV taking the vaccine. And so I called her back. I said, so are you going to take it now? So I think you're absolutely right. Educating the community is what it's going to take in order to change this myth.
And acknowledging the fear.
Yes, acknowledging the fear, not displacing it. Thank you. All right, so anybody has any questions? Looks like I have one person from the chat, and it says, as a Caucasian healthcare professional, how can I best educate the minority and earn their trust being of different color? Excellent question. How do you answer that, Dr. Broadnax?
One would think that the obvious reason for the distrust is race. But it is not as much race as it is the person authentic. People can tell when you are inauthentic and are just repeating what you have read in a brochure. Can you answer all of their questions? Are you just in the community because these are the hours that you need to put in for public service? If you are there to sincerely help the community, it will come across. And you build trust by being there continuously, not just here today and then disappear, and then you come back again and then you disappear, because you have to build trust. We have had multiple experiences with the healthcare community, and it's not always about race.
Yes, you're absolutely right. You do have to build, and me being the first in many things, the very first African-American and the only African-American in my PhD program, the only African-American on several boards I'm on, the only African-American on some national boards. And you're right, it's hard to build that trust. It really is hard.
I just also wanted to add that, you know, the fact that you're willing to break that boundaries is actually a good thing. And sometimes we don't know all the answers. So it's okay to even say that. I really don't know all the answers, but I'm here to figure it out with you. To create that authenticity and also the trust versus, you know, giving information that later might not be all, you know, true or not fact, or the facts are not all presented. It's not sometimes because you don't know that, it's just what you have available to you. And it's okay to hold on to that and say, well, here's what I know right now, and here's how I can help. I think the biggest part is also asking how you can intervene versus always giving out information. So I know that one thing that I am learning to do when I'm doing population health programs is also to take the feedback from the population I'm engaged in. As nurses, we really want to advocate, and we end up giving more information than listening. So making sure that skill set of listening is part of your way of reaching out. Sometimes it's perfectly okay to just listen to what people have to say and later try to help. That definitely earns trust when that is done.
And that goes back to therapeutic communications. I mean, we learned that in fundamentals, listening, and restating the question to the person saying, well, could you tell me, how can I help you? And I've done that in numerous chaotic situations, whether it's handling with a patient or in a board situation or even in a faculty meeting. And I would just look at the person. Well, could you tell me, how can I best help you? And sometimes using that therapeutic communication really help as well, because that shows that you're sincere. You're really just laying it all on the line. It's not about me, it's about you. How can I help you? And I think that makes a difference as well. No matter what color or what race you may be, that shows and makes a difference. It really does. Another question, as a provider of color, we also have to build trust. Just because we're the same color does not automatically earn someone trust. As Pier stated, acknowledging a person's fear is key. That is very true, because Dr. Broadnax, you also stated there were not only just people of other races, like a Caucasian person with the Tuskegee Institute. There were some African-American people there as well. I think wasn't there a Black nurse there?
Yeah.
You know, I'm glad you brought that up, because that's a very personal story for me, because I had my great uncle who was a part of that study. I grew up in Tuskegee. My family is still in Tuskegee, and lots of my extended families. And in fact, we knew a former attorney, Fred Gray, who was in Tuskegee, who actually took on the Tuskegee study to participate. And even now my sister's a school teacher in Tuskegee that I am trying to convince her and her family to take, because in their population, as I speak to them in Macon County, Alabama, to try to convince people who are descendants of the Tuskegee study to even take the vaccine. And I bring that here with me in New Jersey, to your point, to say, when you can build trust and have had those experiences, it does gain a little more credibility. I mean, people don't know any of your past experiences, but oftentimes sharing those personal experiences with people that can get them in a space where they can actually trust and believe you, because there's sincerity about it. To a Caucasian or even an African American or other individual who is trying to convince another person, it ultimately it is your individual decision. And we'll get to the healthcare workers in the next question. But I think those personal stories and why that vaccine meant to you, what it meant to you, what it meant to other individuals down to the level, it's very important. It's still to this day, and I'm glad you brought it up, as old as the Tuskegee story is, it's still amazing that still circulates in the hearts and minds of many African Americans to mitigate not getting health care today, and not just the vaccine. So that is that's key to mention that study.
Thank you. And like you said, I can really see where the descendants of Henrietta Lacks and the descendants of the Tuskegee soldiers, any vaccine or anything, they would automatically say, no way. So yes, it would be very difficult, but like you said, it's personal. So I get it. So Ms. Dell, the next question is for you. What does it look like for a professional healthcare worker and paraprofessional frontline workers? What does it look like for them taking the vaccine?
Well, it looks very interesting. So when the vaccine first came out, we had that very first wave of healthcare workers, and what we as healthcare workers had to decide, because the CDC defined healthcare workers first as anyone who worked in the healthcare profession, and then it dialed it back to say frontline workers, which made a big difference, because there are healthcare workers who don't work in the hospital setting, and then there are healthcare workers who do. So speaking from those who are those frontline first responders, direct care providers, they're more apt to receive it. And I'd say probably, and without statistically given any real data, probably 60% of the environment that I'm familiar with. The other 40%. So what I personally witnessed and have seen in many of the hospitals that I've been engaged with is that a lot of minorities and healthcare workers have already had the virus. And in their minds, that I don't need to take the vaccine because I've already set up an immunity, which is a false sense of security, because just because you've already had the virus does not guarantee immunity moving forward. And every study that's out there that said that. The second thing is that healthcare workers, because we do what we do, because we care, are fundamentally humble. Let other people get it first. I'm already in the trenches, and let other people. Thirdly, what they look like, they say too, is I'm already wearing a lot of PPE anyway. I haven't gotten it, I'm already protected. So why should I take the vaccine? I'm not gonna stop wearing my mask and my protection after I take the vaccine. So why take it? So in interviewing several healthcare workers doing that, it's been interesting too, particularly those who've already been infected, who seem to be the most resistant that I run into, to say, I don't want to, I've already had it, I don't think the vaccine is gonna do me any good. Now, on the flip side, our healthcare workers are big advocates to get patients vaccinated, protect themselves. They're big at telling patients to get it, like we did the flu shot, and they have to administer it. It almost seems very ironic that we have to give the medicine that we don't want to receive the medicine that we give to others. That's just, it doesn't seem like it makes much sense. But in essence, it does, because it may be good for you, but not good for me. And so healthcare workers are spending more time debating the science than the average lay person, because oftentimes, even as nurses, we know just enough to be dangerous. And that oftentimes can work against us. Most times it works for us. But we have to be careful with assuming having PPE, assuming already having the disease, or assuming because we're wearing and we're working in this environment that we're more protected than other people outside the healthcare environment or hospital environment.
That is so true. So my question is, how do you feel, what can we do about doctors and nurses who don't want to take it? What could we do about it, and how can we support them? Because like you said, they're willing to administer it and give it to a patient, but they don't want to take it themselves. They're going to educate and tell a person about it, but they are not listening to what they're telling these people. And so why would a doctor not want to take it, or nurse, and how can we support them as coworkers or managers?
You know, and that's another great question. So I've had conversations with several emergency room doctors who you couldn't get more frontline than that, because literally patients come through the doors, and their perspective on the several that I've talked to is, I'd rather have other people have it that are more vulnerable to it to prevent from getting sick than me take it. So they feel like they're taking it and preventing other people from getting the vaccine itself. And they don't oftentimes feel like they're deserving to get it. And because of that, they often argue the point that until I've heard one physician say, until every person who comes to this hospital gets the vaccine, and I know there's enough to go around, I'm not going to spend it on myself. So we do spend time, although it's a false narrative, but tell them too, the best way to take care of your patients is for you to take that vaccine yourself. And they've convinced others. There are a population like nurses, if I see you get it, I'll get it. And that's where I spent time, making sure we took pictures of healthcare physicians, nurses that actually got the vaccine to prove it to other people that we got it too. Healthcare workers, again, some of the physicians think that I've talked to is, if I get the shot and get sick, I can't provide care to others. So I know I'm healthy now, and I'm giving the injections now. I'm not missing any days' work. And again, these different narratives go very deep. And the thought is, anytime they hear someone else get sick or have a side effect, the thought is, I can't be out of work because I'm here in the trenches taking care of patients. And again, the other physicians back them up and say, again, you can only be healthy as good as you can receive the medicine to take care of others.
That is amazing. The doctors, come on. So we got a question in the chat box. I admit I debated the science, which caused me to delay getting the vaccine. I was reluctant, but ended up taking it much later than it was offered to me. Yep, I'm sure that happens all the time. And sometimes, believe it or not, it could be even your minister telling his entire congregation not to take the vaccine. How do we deal with that? Because usually they listen to two people, their minister and their doctor, okay? Those are the two people. I was a business owner at one point, an adult daycare, and they would come in. My doctor told me to come, so here I am. My minister told me to come, so here I am. And that's how I got my patients. And so if the minister is telling that entire congregation, that's not good. So I feel that a lot of the community conversations, we need to go to the head, to the ministers themselves. I have a question in the chat box. Does getting the vaccine ensure immunity? Who would like to take that question?
I don't mind at all. And because we have some research physicians who work here, and I've read the research in several different journals, and it does provide immunity. Nothing provides 100% of any immunity. And it's very careful to say that that's why all the vaccines that are out there, the makers and the producers are always truthful to tell you the level of protection that you actually get. But it does not provide complete immunity. It does prevent you from having the symptoms. And I think that's the important thing to think about. If you do catch the virus again, the symptomatology that you will have will be a lot less. You won't risk your life situation like you would if you were totally unprotected. So that does. And then it also, as we all know, protect you from contracting it for others, or if you did have it and didn't have the vaccine, giving it to others. But it does provide some immunity, not 100%, but it does.
And I have a follow-up question. Thank you for the person who brought that question up in the chat box. I guess my follow-up, of all of the vaccines, how do you feel about the 1-dose vaccine compared to the 2-dose vaccine? The 2-dose we're dealing with now is Moderna and Pfizer, and the 1-dose that's coming up, I think, is Johnson & Johnson and AstraZeneca. What do you think, or as far as the efficacy with these vaccines, with the 2-dose or the 1-dose? I mean, what's your view on that?
So I would answer this way. What would you prefer, Advil or Motrin? Would you prefer acetaminophen or Tylenol?
I get it. It's the same.
It's the same. It's the same. It may be 1 dose here by this maker, 2 doses here by another maker that produces the same type of support and immune response. Absolutely. There will never, and I think it's good for anybody's economy to have more than one maker of one product as well, so you can actually get it out to as many people as possible. But the efficacy, I don't think that it changes. I think the makers are different and have different components. And again, Advil is made by someone else, Motrin is made by someone else, and you get the same desired outcome.
Very good.
I like the way Dell put that too, because I think this is the type of conversation we should be having in the community as well, because there is always a generic and a name brand to medications, and Dell said it very well in regards to how to pursue. I've never thought about that, Dell.
I love the way she answered that.
I agree with her.
Yeah.
Yes.
It's certainly a way of educating ourselves too, and how to use simple words to explain things to our community. Not just because they don't know, but if you think about it, you know, there's a lot of people who went through the clinical trials to have this available. And I think one of the main concerns has been it was too rapid. But there was a lot of resources put in the research that was done. And that's the difference. You know, usually research goes on and on because there's not a lot of people who adhere to it or even sign up for it. And it's very, in our communities, if you look at clinical research and how many African Americans or Latinos were involved in the study, it's something that we have to educate our community about. It goes through that process. So the more we are engaged from that end, the more we realize what it took to get there. And I think the unknown is that we were not involved, so we really don't know how that went. So clinical trials is a huge thing that we have to also start educating our communities about, because whether it's the vaccine, whether it's medications, it goes through that process before it's outlined to all of us.
But one comment I want to add, and thank Dell for bringing it forward. No one can do patient education like a nurse. One example, and you have it, and everyone will take that same example. Everyone on this call will use that same example when they educate others about the differences in the vaccines. But one point I wanted to make also, to build on what Dell said, physicians and nurses are humans. They may tell you one thing, but the fact of the matter is, I'm afraid to take it. You know, I have all of these reasons because I know a lot of words and I know how to use words, but the bottom line is, not yet. Let someone else try, let someone else go first, and maybe next month. You know, but I can't tell Dell that, you know, I'll tell her something else. So also understand that physicians and nurses and other healthcare providers are humans.
Exactly. They're just humans in a uniform.
That's
exactly
right.
That's true. When you gave the perfect example of the ER physician, I could tell it was an excuse, but that was his excuse that made him feel comfortable to say, oh, I need to make sure everybody else get it first before me. I don't want to take away from anyone else. That was a good excuse, but still, like she said, you got to take care of yourself first before you can take care of others.
You know, I want to add one other, as Dr. Broadnax mentioned too, how real we make it. Recently, you know, I had a daughter that was in an accident, but being in the emergency room oftentimes with patients who come in very ill. And I'm interested, since we had the vaccine, that oftentimes patients who come into the emergency room in pain for whatever reason never asked, what are you giving me? They don't ask, what have you researched about the IV? Is how quick can you give me whatever you have to decrease this pain? And I would like the vaccine to be seen the same way. Is if you don't question the medication that you're going to receive for the pain you're in, and you know, we don't know who researched it, we don't know what trials was done on it, we don't know what test case was done on it. All we know when we walk in is, please stop the pain and give me what you got. And that's why we need to look at the vaccine the same way. You have this death illness, and we should be able to trust it just like we do when we trust it unequivocally when we walk through the doors of the ED and willing to reach our arm out, have a needle inject something in it, and hope that we get the desired outcome and results that we're looking for. And that's to be either free of pain or free of disease.
I love it. And I like to think of it as the flu vaccine. Every year, healthcare workers, we go get the flu shots. And do you guys think that eventually COVID is going to become the same way every year? Did you get your flu shot? Did you get your COVID shot? Do you guys think that's the way of the future?
I do.
Yeah, I do.
Yeah.
Yeah, I think so too. And then of course, you're still going to have the group of people who never get the flu shot and they don't understand why they got sick. And it's going to be the same with the COVID shot. No, I never get it, but I don't understand why I'm in the hospital. So yeah, I think that's going to be the future. So to wrap it up, someone said, excellent point, Dell, on the last point you just made about you show up to the ER and you just have your hand out, just save me. Okay, it doesn't matter what you're giving me, just give it to me. Yeah, excellent point. So my next question, and this question is for each of my panelists, and I'll start first with you, Angela. And the question is, where do we go from here? Where do we go from here, Angela?
Yeah, I think that this is a healthy way to start. Where do we go from here is having the conversation and putting it out, questions that we have. Where do we go from here is when we get back to our designated places, whether it's in the community, the hospital, or schools, it's just trying to continue to talk. I teach in the schools too, and I have had, 17, 16, 18-year-olds say, well, I can't get the vaccine right now, so what do I do? But you can learn about the vaccine and teach about to your grandmother as to how they can help themselves. Or you can go back into your community and talk about it. The dialogue we're having should be continued and not just stopped because we heard our questions were answered. But how do we take this and move it on to where we live, or to our churches, like you said, or to our communities, and try to make this more of an ongoing, because like you said, we just started the journey of the vaccine. And the whole 2021 will be addressing different sectors of the population and how they can get the vaccine. Yes, we started with healthcare providers, but down the line, we're adding more, the aged, and also, so how do we make sure as nurses and as healthcare providers, we take this conversation into our communities? And I think that's where we go from here. And some of the tools we can is partnership. I know some nurses have said that, well, I don't have that capability of talking to someone to say, hey, my community needs this. but we do. That's what we sign up mostly for, to be advocates. And knowing that, yes, one conversation can lead to something that can produce an outcome, whether it's impacting one or millions of people, it's okay. But we have to start that dialogue.
Thank you. And Ms. Dell, where do we go from here? And Ms. Broadnax, I'm going to give you the last word to sum us all up, okay? So Ms. Dell, where do we go from here, especially in the hospital setting?
I think that the easy answer would be is to continue to build trust, just like Dr. Broadnax said. The best thing to do is, one, is communicate. If you can be a genuine, authentic communicator about it, tell your personal story. Tell why you got it. You can't advertise for the vaccine if you didn't have it. That's just not gonna cut it. I tell the physicians all the time, you're not an advocate if you didn't get a shot. So make sure you do that. You got to be able to buy something and to sell something. That's where we go to. And then get to your nearest relative. It's difficult to convince a stranger. It's easier to convince a friend. So start with those, and that chain continues to grow and it continues to link to others. We're not here as healthcare workers to solve world peace and cure every ailment. But my motto is that if I can help save just one, and that person saves just one, that link continues. And that's where you go. And that link continues to go to other places.
Very good. Thank you. Well said. I think that was really good because education is the key. Like I said, go straight to the head, the church. If you're going to tell your entire congregation not to take the vaccine, well, as healthcare workers, we need to go to the bishop or the pastor or the leader of those organizations or the ministerial alliance where you can meet with all of the ministers together at one time and educate them. And I think that's important. And then with you, Dell, like you said, all of the doctors, they get together, they have a huddle. Well, we need to have someone, if they're not going to take it from the nurses, who will they listen to? It has to be someone other than the nurse for those physicians, like a Dr. Fauci. It has to be somebody like that. Who are you going to listen to realize you're harming yourself by not taking a shot and trying to deliver care to others? You really are. So you're right. So we're going to sum it up with Ms. Pier Broadnax. Where do we go from here, and how would you like to sum up our dialogue today?
Well, I'll tell you what has come through the continuous thread is the building of trust in the communities, with our patients, with one another, trust in the science. But the overall feeling is that we must build trust that this vaccine will be effective in combating something that we did not foresee, did not understand, were not prepared for, but we're doing all that we know. And I tell you, we've discussed multiple strategies, but I always look at us as a people. What do we do most? We fight for others. We fight for our families. We celebrate. Why not collaborate with National Black Nurse Association, your local chapters, who will partner with Chi-Eta-Phi sorority, who will collaborate with the various sororities in the local area, and have a day of education and giving shots. I can't think of anything more clever than that, but just have a day of that. And you have a mask. What do we like? Something branded on it. You know, I had my shot. You know, you have some kind of mask. I participated. I'm covered. I'm something. But we celebrate, we advocate, which we showed what we could do in November when we all came together in one voice with one focus. But let us save our community. We know what to do. We know how to do it. We know what is needed. We will support our elders. We will support our ethnic communities. You know, I can't go in everyone's community and tell them what to do because I don't understand their culture. but I will partner with someone who does understand. And we will all come together because we cannot fight this virus by ourselves. It is bigger than us, and we will have more dialogues to bring current information to the forefront. Not everyone has access to a journal. Not everyone is able to read. So it's up to us. We're nurses. We know how to do it. We know how to come together. We know how to bring the community together because they trust us. So thank you everyone for being on this call. And I hope you were able to take away something that would benefit you, your family, and your community.
Thank you so much to the panel. And I love it. All nurses, all community coming together, it doesn't matter whether you're Filipino, Hispanic, it doesn't matter what ethnic background, but we're in this fight together. It is not one race, it is all races coming together to eradicate COVID-19. So thank you, panel, for being on the panel today. And thank you everyone for enjoying, I call it lunchtime, like having lunch and information. Thank you so much. I appreciate you. Have a great rest of your day. Goodbye, everybody.
Bye.
Bye-bye.
Bye-bye.
Bye-bye.